Welcome back, my people. It's my hope the weekend is turning out to be a good one. Mine also is good. That's why you can still see me here, committing myself to give you what I've been giving you each and every day. And I do appreciate those who have been following my videos, and they are really appreciating what they are getting from my videos. They are really appreciating the knowledge they are acquiring from there. Why should you be left behind? Kindly just subscribe, hit the subscription button, and put the notification bell on so that whenever I make a video, YouTube will automatically notify you. So let's keep the support on. Let's get back to our point of discussion. As I had said before, we are still discussing about food poisoning, and in this video we will still continue discussing about microorganisms or common microorganisms that cause food poisoning. And the first one in this video is what we call Toxoplasma gondii. Toxoplasma gondii. This one rarely causes noticeable symptoms but can be found in undercooked shellfish or meat, specifically pork, lamb, and venison. Contaminated water can be also a source of this kind of microorganism or bacteria. It's mostly transmitted through contact with infected cat feces, but can also be caused by improper handling or preparation of food. Improper food preparation, improper food handling. Next, we have what we call Trichinella. Trichinella takes 1 to 2 days for abdominal symptoms and 2 to 8 weeks for other symptoms, and it's found in raw or undercooked meat, specifically pork and wild game. All these are just rotating around raw foods, improper food handling, improper food preparation. So if you are following me very closely, you are in a position to say which way to follow to avoid food poisoning. The other kind of microorganism is what we call Vibrio vulnificus. Vibrio vulnificus. This takes 2 to 48 hours to show symptoms, and it's found in raw or undercooked shelly and especially oysters. The question is, why are most of these bacteria found in fishes or the fish family, especially when they are raw? So let's prepare our food very well. Let's handle our foods in a hygienic manner. Let's store in our foods in a proper storage areas. For example, if they are storage dishes, the hot pots should be clean, the fridges should be clean, and through this and cooking, proper cooking of food, you will avoid food poisoning. So that makes the end of the discussion about the microorganisms that cause food poisoning. So let's talk about this one notorious virus common in children called rotavirus. What is rotavirus? Rotavirus is a type of infection most common in children under 5 years old, and it's highly contagious, and the virus that causes it is easily transmittable. It occurs most often in young children, but adults can also develop the infection, although it's usually less severe. So to children it's more severe, to adults it's less severe. I hope you get that. Centers for Disease Control and Prevention reports that the rotavirus vaccine was introduced in the year 2006, and the vaccine is more than 90% effective in preventing severe rotavirus disease. Let me repeat this one. Centers for Disease Control and Prevention reports that the rotavirus vaccine introduced in the year 2006 and is more than 90% effective in preventing severe rotavirus disease. I hope you get that. So if you have a child, make sure he or she gets the rotavirus injection or the rotavirus jab, as it will prevent rotavirus severe complications or severe cases. Rotavirus doesn't require medication. It usually resolves on its own with time. However, dehydration is a serious concern because of the diarrhea and vomiting. Because one of the symptoms of rotavirus is diarrhea and vomiting, so the child will obviously dehydrate. So even if it clears away by itself, it's a matter of concern. As we have been discussing, most of these viruses clear by themselves. Why? Ask yourself why. The reason being, your body immune system is the one that fights viruses. So if you have a strong immune system, it will be easier for you to fight rotavirus. Let's see the symptoms the child will present with when he or she is having this rotavirus. So, symptoms of rotavirus tend to be prominent in children. Rotavirus symptoms in children include the following. Number 1, vomiting. Number 2, severe fatigue. Number 3, high-grade fever. Number 4, irritability. Number 5, dehydration. Number 6, abdominal pain. Number 7, diarrhea. Note this, children are most prone or vulnerable to a loss of fluids and electrolytes. Children, let me repeat this. Children are most prone or vulnerable to loss of fluid and electrolytes through vomiting and diarrhea because they have smaller body weights. Let me repeat this again, and it's a point of concern, a point to note. Children are more prone or vulnerable to a loss of fluid and electrolytes through vomiting and diarrhea because they have smaller body weights. Yes, they have smaller body weights. So children will lose more fluids compared to adults because they have smaller body weights. Symptoms of dehydration in children include the following. Number 1, dry mouth. Number 2, cool skin. Number 3, lack of tears. You may find that the child is crying but not producing any tears when crying. Number 4, we have reduced urination frequency. So the child will urinate, but the frequency will go down simply because the levels of water in the body are down. Next, we have sunken eyes, which is always a sign of dehydration. This marks the end of our discussion today, and in our next video we'll be discussing about rotavirus in adults. So guys, let's continue keeping the support on. Thank you for the subscriptions, thank you for the support, thank you for being my family, and each and every day is a new dawn, and through your support, even my confidence to educate you is going high each day. So guys, let's meet in the next video. Have a wonderful weekend, and take care of ourselves. It's on Christmas holiday. So, for those who are traveling, let's take care of ourselves.